So, your dog has been diagnosed with a cranial cruciate ligament tear. This means that the ligament that stabilizes the knee or prevents the tibia from slipping forward has been partially or completely damaged. And it is this instability that leads to inflammation, pain, and progressive arthritis if not addressed. So, why did this happen? Well, the veterinary consensus is that most CCL tears are not purely traumatic. Instead, it's a combination of genetic and environmental factors that leads to progressive degenerative changes of that ligament until that ligament either fails due to an injury or repeated microtrauma. Breeds like Rottweilers, Labrador Retrievers, Newfoundlands, Staffordshire, or Pit Bull type breed dogs are at higher risk, but any dog can be affected. Did you know that there is one risk factor that can increase a dog's risk of getting a knee injury by 4 times? That's canine obesity. Your dog probably came in looking something like this. The history often includes something like sudden severe lameness or intermittent limping over time that suddenly worsens. And this usually happens when a partial tear either becomes complete or we have new meniscal damage on top of everything else. How do veterinarians confirm cruciate tears in the knee? Well, on physical exam, they would have noticed something like joint effusion or swelling. Medial buttress, which is a thickening of the inner side of the knee in chronic cases, and also pain of the knee with hyperextension. Now there are some really cool physical exam tests they can do to find out if there's truly an injury to a dog's knee. One of them is the cranial drawer test, and this test will show abnormal movement of the tibia forward due to the instability of the knee. The second is the tibial compression test. This test evaluates joint instability using different joint mechanisms, but is looking for a similar abnormal movement. And while not always, it is important to remember that this test is often done under sedation. Because it's painful, a dog will guard that leg and resist movement. X-rays can be very helpful when diagnosing a cranial cruciate tear. While they don't actually show the ligament torn itself, they do show soft tissue swelling in the knee, displacement of the infrapatellar fat pad, and signs of arthritis or medial buttress in chronic cases. This is a test that can actually be done at home to see if your dog has a knee injury, and it's called the sit test. Dogs with an injury won't sit squarely. Instead, they'll stretch out the affected leg in order to prevent them from bending the knee. And then there is advanced testing you could do like MRI or arthroscopy, which can be used to confirm a cruciate injury and other injuries, but this is generally done at a specialty hospital. So what happens after your dog is diagnosed with a cruciate injury? Are they doomed to forever be painful and lame in that leg? There are 2 treatment paths when it comes to canine cruciate injuries, one of them being gold standard and ideal for all dogs, while the other one being a potential option if your dog weighs less than 30 pounds. The gold standard and ideal therapy for cruciate injuries in dogs is always going to be surgery, especially in dogs that weigh over 15 kilograms or about 30 pounds. Common procedures include extracapsular repair, TPLO, and TTA. Now there is no single universally accepted best surgical method overall, but in general with these methods, 85 to 90% of dogs return to good function. And these are typically performed by our board specialty surgeons or people with very high interest in orthopedic surgery. Now if a dog has a cranial cruciate ligament injury, do they have to have surgery? No, but there are some special factors to consider. Is the dog under 15 kilograms or around 30 pounds? And is for some reason surgery not feasible, whether it's due to other comorbidities or illnesses, or due to finances? Because in an ideal world, all of these cases would be treated with surgery. But in smaller dogs, with strict rest and rehabilitation, roughly about 60 to 85% will show improvement. However, if no improvement is seen within 3 to 4 months, surgery will be highly recommended. And you might be thinking, if a dog has a knee injury, can't we just put a brace on it? Well, there's very limited evidence as to the success of these therapies, as well as companies that produce quality products. In general, braces are used when surgery is not possible and as a supportive option only. If you're curious, here are some companies that do produce braces, and I'll link their websites in the caption. But as for now, it shouldn't be considered a primary treatment. Now, regardless of treatment path, your veterinarian is most likely going to prescribe some pain medications in the form of NSAIDs, possibly gabapentin, amantadine, omega-3 fatty acids, and more. Now there is one huge factor that most people miss when dealing with cranial cruciate or knee injuries in dogs, whether that comes to medical management or surgical therapy, and that is weight management. Body weight can make or break a recovery. Like I said before, being overweight can increase a dog's chance of injuring their knee by 4 times. And don't forget, they still have one other knee. So listen when your veterinarian gives you a calorie goal and a weight goal, and monitor this closely, because about 50% of dogs that injure one knee will injure their other knee in their lifetime. And through the recovery process, things to monitor for are potential medication side effects, improvements ideally, or flare-ups in lameness, as well as changes in weight. And with any injury, including cruciate ligament injury in dogs, here's why rechecks are so important. They help you and the veterinarian monitor healing. They help you track the weight. And they also allow for very important blood work checks, especially if using anti-inflammatories long term, at 2 to 4 weeks, and then usually every 6 to 12 months afterwards, to check on the liver and the kidney. And most importantly, they help your vet to change medication dosages and frequency, decrease them to the lowest effective dose, which in the end will save money and decrease the amount of medications your pet is exposed to. So here's my summary of what is important for you to know for cranial cruciate ligament injuries in dogs. This is a degenerative, genetic influenced disease. Surgery is the most reliable treatment. Medical management works best in smaller dogs, less than 15 kilograms. Arthritis will develop regardless, but we can slow it down by a lot. And weight control and rechecks are super important. Once again, I'm Dr. Cook, aka Catalyst Vet, and if you have any more questions, then please comment below. Or if you want more information, then click on these associated videos.